today we are going to have our queen have a presentation. And today is actually giving me a deja vu because this is on the same platform that I once contested for Miss UHAS. And who would have thought that I'll be emceeing the same program today? Let's welcome ourselves with a hand of applause. So the program is officially starting, and then we would like to call one of us to give us an opening prayer. So we'd like to call Miss Denise. When are you going to give us? Please come and give us those. Heavenly Father, we thank you this afternoon. We are grateful for your love you've shown to us this after this during this week. Father, as we have gathered here, we pray that you strengthen us, you give us wisdom to do whatever we planned here today. In Jesus' name we pray. Amen.
Amen.
Thank you. Okay, so at this point we would like to acknowledge our judges. And then please, when I mention their names and their portfolios, I would like to welcome them with a clap. So we have in our Miss Anna Echansiao. She's a registered dietitian at the Royal Hospital and a former federal SRC form 2021-2022 academic year. We have Miss Diana Amenubebe Down Anku, sorry, and she's a nurse and a former federal SRC form 2023-2024 academic year. We have in our Miss Rahel Babatunde Taiwo. She's a final year student physiotherapy and a former clerk of the SRC Parliament. Please let's welcome her as well. So without wasting much time, we'd like to invite our current WOCOM for UHAS SRC, Miss Joanna Yuenchi, to deliver a welcome address. Let's clap for her as she comes. So just as she said earlier on, today we are having a health and power presentation. And on behalf of all the organizers of Miss UHAS, I would like to welcome you all to the presentation. And then those of us viewing us from online too, you are welcome. We hope you enjoy. Thank you. Dare to dream, inspire change, and showcase the qualities that make them outstanding ambassadors of our university. So at this point, we would like to go to the judges and we would like to note their expectations for today's program. So we'd like to start with Miss Anna. Miss Anna, please, can you take the microphone for us?
Okay, so I believe that by now our contestants are well prepared for the various topics that they've selected. So our expectation is to see excellent work being done and then an opportunity to also learn from them. Yeah, that's all I'm expecting today. Thank you.
That's right, an opportunity to learn from them. Let's give her a round of applause, please. Miss Diana, please, can you?
So over the weeks, we've been we've been monitoring what they've been doing, and then we gave our comments, and also we are expecting an improvement in all the areas, eloquence, and then content and all that. So I'm hoping to see the best from them.
Okay. Best indeed we are expecting from you. Let's give her a round of applause. Then Miss Rahel, our last speaker.
Yes, I'm expecting a showcase of their personality, their confidence, and a group presentation of their topic.
Thank you very much. So, Queen, you heard from our judges. Please, we are expecting nothing but the best for you to showcase all that you have. I remember I cried on this stage, but then I hope that doesn't happen to any of you. So, we better give a hand of applause when the queens ascend the stage and descend as well. So, let's give a round of applause right now. It's not an easy task, I tell you. So, at this point, we've already introduced our judges. We have UHAS Base TV here. Can we welcome them, please? So, we would like to know the key rules with this context, content, contest. Sorry. So, we'd like to know the key rules, and then we are getting that from the judges again. So, we want to know what rules we are abiding with. So, who is going for us? Will Miss Rahel do that for us? Okay.
Hi, so these are the rules. So presentation is 15 marks, 10 minutes. You have 10 minutes to do your presentation.
Yeah.
So there is going to be question and answer section, 10 marks. And so I've already mentioned 15 minutes presentation plus 10 minutes question and answers. So we're also going to take into consideration how they've dressed, how well they've put together their content, how they are going to present, their articulation, their eloquence. Of these things count. Yeah, so all the best, queens. Thank you.
So, without wasting much time, we'd like to call on our first queens who are going to do the presentation. 15 minutes presentation, 10 minutes question and answers. So we are 10 minutes presentation and 5 minutes question and answers. Okay. So we'll call on the first group. Miss Sylvia. Yes, please come forward. looking for, where our queens are going to present. So without wasting much time, I would like to call our first presenter, who is in the person of Sylvia Kwekunaka, to present her. Please let's welcome her with a clap, please. Imagine a world where people get to learn, eat, and imagine a world where people get to learn, live, and actually live their life because they are not and topic for today is the importance of balance. What is balance? Balance diet is all the essential nutrients in their correct proportion that support healthy food, protect the body food, there are six essential there are six essential components of balance, which are carbohydrates, protein, fat, water, vitamins, minerals. Carbohydrates is the body's primary producer of energy, which means the body gets most of its energy from carbohydrates. And some of whole grains and brown rice. When we talk about protein, it's efficient for muscle growth and it helps with very well nutrition. Example sources are legumes. Some of the sources are legumes, lean meat, and fish. Then we talk about the other components, which are fat, water, vitamins, and minerals, which are also essential for the balanced diet. Then we move on to why balanced diet is important. Balanced diet is important for disease protection. Balanced diet is important for disease prevention, and it helps in reducing the risk of non-communicable diseases such as stroke, heart diseases, and diabetes. Yeah. Okay, so it's fine. It's up. Right. Balanced diet also helps in managing healthy weight. When you take in balanced diet, it keeps you satiated and it prevents obesity, hence managing the healthy body mass index. And we also what happens when we don't eat balanced diet? Not eating balanced diet can result to malnutrition. And malnutrition can also lead to undernutrition, which is stunted growth, or overnutrition, which is obesity. Not eating balanced diet can also result in fatigue and weakness, which is lack of the essential micronutrients can cause fatigue, which is tiredness. Tips to achieve a balanced diet. One, you must limit processed foods. And then two, you have to stay hydrated. You have to drink water instead of the carbonated drinks we take most often. And then another way is also cooking at home. Because when you cook at home, you control the ingredients that you use. Please come in. And then another way, another tip too is dividing your plate by filling a half of the plate with colorful fruits and vegetables. And also one platter with lean proteins and another platter with whole grains. In conclusion, balanced diet is essential for good health and overall well-being. It strengthens the immune system, provides energy, and supports growth and also prevents diseases. So therefore, food is medicine. So whatever you take in is going to shape your lifestyle. So you can start today by changing your diet by adding vegetable to every meal you eat. Thank you.
Then, Sylvia, please come back. Question and answer.
Hi. Hi, Sylvia.
Hi.
How are you feeling?
Not too good.
Not too good.
Yeah.
Why?
I don't feel like I delivered like I should.
So it's a learning process, okay? We learn every day. But I have one question I want to ask. This is a presentation, right?
Yes, please.
So what is the format for presentation? I mean, the presentation material, whatever you're giving out, what's the format for it?
So actually, I didn't know the presentation was going to be projected. So I had everything in my notes. So I just did it here. Everything. Yes. Yes. So I wanted to talk about the importance of eating a balanced diet. So I was going to talk about the importance of eating a balanced diet. Thank you. Thank you. Thank you. Yes, yes. Yeah. Thank you. Miss Sylvia. That was regardless a remarkable
Oh, Chim.
presentation. Please let's give her a round of applause again.
No, 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 no. You guys just want me to.
So the competition is growing fiercer. Can we relate? Okay, so at this point, we'd like to call our second contestant in the persons of Deborah Adeline and Joanna Elom Topo. Please, can we welcome them as they come?
But we can't communicate from this. I think we can put it for me by that. Your phone is here. Actually, Joanna or Ellen. This is actually
Fabulous ladies and gentlemen, of course, you are welcome to the ladies. Fabulous ladies of the Ladies Circle. Of course, you are welcome to the Ladies Circle talk show right here on TV3, happening this and every Sunday at 2 p.m. And Jesus, please, I will take it again. Fabulous ladies of the Ladies Circle, noble judges, ladies and gentlemen, you are warmly welcome to the Ladies Circle happening right here on TV3 this and every Sunday. And I'm scared. Fabulous ladies of the Ladies Circle, you are welcome, noble judges, ladies and gentlemen. You are welcome to today's Ladies Circle talk show. And today's episode, my name is Joanna Elom, and I will be your host for today's Ladies Circle talk show, which is all about hair future, our health. Our guest for today is Miss Deborah Adolin, and I would like to take a quick break while she settles in.
Let's clap.
Miss Deborah, we are glad to have you here today with us as our guest.
Thanks for having me.
Miss Deborah,
Yes,
we
please.
are glad to have you in our midst today as our guest. How was your journey? How is everything? How are you doing?
My journey was good, and thanks for having me on your talk show today.
I heard UHAS is a very nice campus, and I'm planning to have a tour over there one day. Am I invited?
Yes, we will be glad to have you in our campus.
Okay, so today I would like us to talk about something that is silently breaking women down, but it is 100% preventable. So the topic for today is cervical cancer. What do you have for us on cervical cancer?
Okay, thank you very much, Ms. One, for giving me this opportunity to be on your talk show today, Sunday. Yes, thank you very much. As you earlier said, the topic for today's show is measures to curb cervical cancer. Sorry.
Yeah.
Yes, so when we say cervical cancer, it's an abnormal growth in the cervix, okay? And the virus that causes cervical cancer is HPV, human papilloma virus. And we have a lot of viruses, okay, over 200 viruses that causes that. But the most difficult one, the most common virus is the HPV 16, 18, 33, and 55. Yes.
Okay, so let's imagine Amma,
Okay.
a 90-year-old happy student who suddenly notices an unusual bleeding, feels very tired, and she just brushes it off as stress. And then after 2 years, she was diagnosed of having advanced cervical cancer. How will you take this scenario? What would you have to say about such
Okay.
scenario?
So as you said, I would say that Amma ignored her symptoms. Okay, that's the bleeding the irregular bleeding she was having. Um, she was experiencing some issues and then having some abnormal growth, but she felt maybe it is normal. Yes, but if she had spoken to somebody or if she had gone to the hospital after seeing those 30 symptoms, she would have been educated on what to do, and then she would have gotten a help to treat them.
So that means cervical cancer breeds in stages, right?
Yes, we have stage 1 to 4. The fourth stage is when the cancer spreads through other organs in the body, that's the lungs or the liver. The second and third is when it has taken all over the cervix. And then the first one is around the cervix and then kind of like our vulva. Yes.
Okay, so the advanced stage she had was more or less like the stage 4 of the cervical cancer.
Okay, before she did treat it, when she saw that it has spread, okay, cervical cancer is kind of like doesn't spread faster. Okay, it takes its time to spread. So if you have the time to treat it, you wouldn't contact that you wouldn't reach the fourth stage. Yes, but because she ignored all these, yes, and that is why she got to the stage 4, and I'm sure by then it has spread all over the other organs.
Okay, okay. Then cervical cancer seems more dangerous than how it sounds.
Exactly.
So is there any preventive care so that you won't contract it before you realize it will be too late?
Yes, so as I said earlier, the preventive measures are you being screened, okay? Screening can be done occasionally, then positively. So if in case you hear that there will be a screen, there will be a health screening at a program, a particular program, I would advise us to all go and get ourselves screened, okay? And then I also think education can help us curb or prevent cervical cancer because if I didn't know anything about. If I was not educated about cervical cancer, I wouldn't know how to prevent it, or I wouldn't know how to act towards it when it happens to you. Yes, and we also have this other preventive measures by you being open, okay, to others, being open to health care providers, okay, in case you see any symptom, okay, or if you feel that, or you don't believe in yourself, or you have a partner who is battling with some infections and you feel you suspect something, you can go and talk to them and they will attend to you.
COVID-19 is having a vaccine to prevent contracting it. So is cervical cancer also having a vaccine you can take for you to, prevent it?
So last year or early last year, we were told that we should take our young sisters between the age of 19 to 14 to the hospital to be vaccinated because it will help them prevent high rate of or the rate of getting cancer. Yes. So if you pass that stage, it's not late. You can still go and kind of like go to the hospital to get yourself treated, or maybe ask questions to your healthcare providers, and they will know if. But the vaccines available aren't for the yes. The vaccine is only for the 9 to 14.
Let me chip in this before we continue. Is the screening and the vaccination at a fee or it's free?
Actually, in some health centers, centers. Yes, we have some of them do it at a cost. Some also do it occasionally free, like when they are kind of like advocating for that or on that day. They normally do it for free, but most of the time it comes with a cost. Yes.
Ladies and gentlemen, I hope we are all listening to Miss Adeline on her education on cervical cancer. Cervical cancer can actually be prevented through education, screening, and vaccination, as she made mention of. And I would like to urge all ladies to get screened for cervical cancer. And also, I would like to, this topic is not limited to only the ladies. Our gentlemen is also urged to encourage their wives, their girlfriends, and their mothers to, get screened for cervical cancer. And also, if you have young adult siblings, female siblings between the ages of 19 to 14 years, make sure they get vaccinated for cervical cancer. Okay, Miss Adeline, is there any preventive measures? Is there any measures like a community can go through about cervical cancer?
Okay, so if we are a community, okay, and we would want to fight against cancer, I would advise that the leaders in our community should organize campaigns, okay, yes, and then they should create awareness to the young youth coming.
Yes.
Okay, I think that was a very informative presentation. I don't know if the judges are also with me. How do you feel after presenting? And Joanna?
Nervous.
We are starting with Judge Anna. Please, what do you make of their presentation?
I would say that with what you chose to do a talk show, I had a lot of expectations for you because for someone like me with some experience with media and all, I was expecting certain things. And let me begin with the first presenter who was the host for the show. My dear, what happened?
Oh, okay.
What happened?
I got nervous.
You got nervous.
Yeah.
Okay. So I said in the first presentation that it is a learning ground for us. Okay. This is not an area to intimidate anybody. Eh? But then still you are supposed to up your game. You get it. As a host for a show, you don't make mistakes and then start laughing and then just moving around. You see the number of presenters that will have alert on stage and so will just find a way of doing it. You see it on our TV stations, right?
Yeah.
It happens, but then you have to get a different way and then just maybe whoever is in listening to you may not even notice that you made a mistake like that. Because of that particular instance that happened, now the whole show felt like just some two children coming to do some play or drama for us. But from the beginning, we were seeing it as a host with the guests coming to speak. I have to get it. And then in this particular setting where we don't have um, microphones, loud microphones for everybody to hear, I was expecting that you'd be audible enough to see what I'm saying. Like you can hear whatever I'm saying, right?
Yeah.
That was the expectation we're having of you. So the made it at the point we were lost. We didn't even get some of the things that we were talking about. But maybe along the line you got it. And then for somebody that's hosting a show, time conscious, because you have your questions, you are supposed to man the program, make sure everything is going as it's supposed to be. I hope you get it. So maybe I know going forward, you look at other shows and then you learn something from that angle. How is it?
Yeah.
So my question I want to ask is that what month is cervical cancer awareness? This goes to our guest.
What is she searches for us?
No idea. Okay, that's fine. My second question is what are the colors for cervical cancer awareness?
No
No
idea.
idea.
Okay. So I believe we all understand what I'm trying to do. These are basic things about the topic you are presenting on. And we're certain that you know one, the month that the awareness is being created, through the colors. And even your outfit was supposed to show something like what you are presenting. How to get it. Even if your whole outfit didn't have the colors, see that ribbon they put on clothes during those cancer awareness. For cervical cancer, the commonest color we use is orange. How to get it. So even if you were not wearing a whole orange dress, maybe that ribbon could have been there. So we've learned something and we'll do better another time, right?
Yeah.
Thank you.
You're welcome.
Thank you very much. When you were giving your presentation, you mentioned that there's a screening that they do, and then in some facilities it's free and all. Can you tell me like the name of the screening that they do for them? Pap smear and what?
Okay.
Pap smear and what else?
Um, that's what I know.
That's what you know. Okay. So we have three types. So I want you to go and read about it. But there's also a particular test that they use vinegar to do, and it's free. They don't pay for it. You get the result instantly. Also, what activity for like predispose you to cervical cancer? I want two from this side, two from this side.
Cervical
Cervical
cancer
cancer
can
can
be
be
spread
spread
sexually.
sexually.
Sexually, eh?
Yeah, that's
That's
all.
all.
Next person.
I can also say that since um, the first stage most can be kind of like treated through our immune system, bad or imbalanced diet can also cause the spread of.
I'm not convinced, but I'll take it like that. But I urge you to go and read more about cervical cancer because this is a topic that I know very well. So I know what I'm talking about. You should go and read more about it, okay?
Okay, please.
Rachel.
Yes, you both did well. But what inspired the host and the lady cycle showcase? What inspired it?
Please come again.
What inspired the lady cycle moment?
Okay, so on the Lady Circle Talk Show, they normally talk about such topics. That's why we took that show.
Why did you decide to do the ladies talk show instead of just presenting?
I believe creativity is also part of this contest that we are doing. So we decided to create something new out from the normal presentation that we know. That's why we did that.
Okay, that's impressive. Please, is cervical cancer symptomatic? Is it symptomatic? Cervical cancer.
Is it?
Symptomatic.
Yes, please. Right.
If you don't know, you can just say you don't know. I don't have a problem.
Sorry.
If you don't know, you can just say you don't know. I don't have a problem.
Yeah, they are symptoms.
You
Yes.
know.
Unusual bleeding, itchiness, and then feeling very tired.
I don't know. I don't know whether
We also
I
have
believe cervical cancer is
you would
symptomatic.
you would also experience pain during intercourse. Yes.
I believe it is
Okay.
asymptomatic. So it's when it progresses, that's when the symptoms come in. Okay.
Okay, please.
And I didn't hear you guys talk about multiple sex partners.
Did you say
Multiple sex partners for the cause of the HP virus.
because of the
HP virus.
please
You-
your question again?
I didn't hear you guys talked about multiple sex partners being the cause of the HP virus?
I think we made mention of you having a partner, and you feel the partner has like, in case you don't trust the partner, yes, you can get yourself tested, but we didn't put it as you just said.
Okay.
What we talk about is not an issue of maybe I have one guy.
I know.
It's about the lady
Okay,
having multiple partners.
okay. We didn't
Yeah,
made mention about it.
because
We
I
did,
believe
but we didn't talk about it, Karen, like
multiple
right
sex
now.
partners predisposes the lady to infection, and I think multiple sex partners is the hallmark of cervical cancer, if I'm not mistaken. What I know is multiple sex partners who predisposes the lady to multiple infections, and that is a hallmark of cervical cancer.
Other infections such as HIV can predispose you to getting cervical cancer. And then there are other activities like smoking. There's another one. I don't know if it's early pregnancy or something about pregnancy too. I know it predisposes you to
The teenage pregnancy.
Yes, please.
I'm not really sure what that is. So I can't talk much to that. But yes, you have to read more. That's what I'm trying to read more.
Okay.
Thank you
And then
so
when
much.
you go to finish your presentation,
So I think we finished.
Are you sure you did?
Thank you.
Thank you so much. Please, you may have your seats. This is indeed a stepping stone. This is indeed a stepping stone. We have in our midst Miss Namsa. She's in the person of Mac Brown. Please let's welcome Mac Brown. Mac Brown, we need a catwalk, please. Oh, a hand of applause for Mac Brown. A hand of applause for Mac Brown. Woo! A hand of applause for Mac Brown. Okay, so I want to have a conversation with the supporters here. How do you feel? How do you make of the ladies' presentation so far?
Okay, so far the ladies are really putting their best foot forward, and then I'm very proud of what I've seen so far.
They are putting in effort, and he is very proud. How about you, please?
Their choice of topics are very interesting.
Their choice of topics are very interesting. Now to our next contestants. Shall we call Mo and Rennie? Miss Blue and Rennie. A hand of applause for Miss Blue and Rennie.
Good afternoon, judges. My name is Irene Afido, and then we are here to present on the topic antimicrobial resistance. But before I go forward to okay. I'm Irene Afido, but for the purposes of this pageant, I'm Rennie. Okay. So we are here to present on the topic antimicrobial resistance. But before I go on, I would like to throw a thought-provoking question to the house. If you realize, you know that the first medication, or back in the olden days, the medication that used to work for malaria was chloroquine. Now, we are using artemisinin-based combination therapy to cure malaria. That's one, let's leave that aside. Now you or I, when we have a common cold or any little infection or any little changes in our body, what do? Some of us, we do not, I'm not saying all of us, but some of us, we do not go to the hospital. We just go to the pharmacy or over the counter, get some antibiotic or antivirus, then we take it in, thinking that this is going to help us. All right, so our topic for today is antimicrobial resistance, a silent pandemic, and its crushing effects, its crushing burden on Ghana's healthcare system. So when we say antimicrobial resistance, I will put it AMR for short. So maybe in the slide, wherever you see AMR, we are referring to antimicrobial resistance. So antimicrobial resistance is basically a situation where the microorganisms have developed resistance towards what? The antimicrobials that we use for them. So when we say antimicrobials, are the drugs that are going to work against the microorganisms, and these microorganisms come in the form of bacteria, viruses, parasites, as well as fungi. So all this are under the umbrella microorganisms. So the drugs that we use to treat these organisms, very soon, like they have decided to create resistance towards our medication. So that is the situation of antimicrobial resistance. Just like you and I, when you go to winter, you go to a place where the weather is very cold, like me. When the weather is cold, I put on my long sleeve or sweater. I am trying to create adaptation towards the weather. It's the same thing that the bacteria do or the viruses do. So that is basically it. So AMR says that the WHO, World Health Organization, they say that AMR is a natural phenomenon where the bacteria or the viruses decide to create resistance towards the medications. But then human behavior accelerates it. It means that you and I, we accelerate the rate at which antimicrobial resistance occurs. All right, moving forward, I'm going to talk about some of the situations where we have the antimicrobial resistance. I can give examples of the methicillin-resistant Staphylococcus aureus. Yes, this is a microorganism that has developed resistance towards what? The medications that we use. The multi-drug resistant Mycobacterium tuberculosis. So it's a tuberculosis situation where the causative organism for tuberculosis has developed resistance towards the antimicrobials that we use for it. So it goes on and on. Now, I'm going to explain the phenomenon. How does AMR occur? Someone will ask. It occurs in two forms: the mechanism with which the organism develop adaptation, and then how they spread faster. So how the organism develops the adaptation, one, they have 5 classic methods that they use. One is they are going to have enzymes within them. You see, when you eat, digestive system, you learned in JHS that we have enzymes that accelerate the rate at which our food digests. It's the same thing with the bacteria. So they are going to create enzymes in them that they are going to use to deactivate the medications. Mind you, our medications are made of elements, compounds. So 2 elements coming together, 5 or more pentane, and the rest, they come together like different elements coming together. So if I have an enzyme that can break the chain between how the medication is formed, I've totally destroyed the medication, so it's not going to work against me. Another way is developing a strong cell wall. So the bacteria, the viruses, the fungi, they're going to develop a strong cell wall, which is going to help the antibiotic, which is going to make it in a way that the antibiotic cannot enter. Just like you and I, we wear long sleeves so that the cold weather cannot enter into our system, as well as they also create channels within their cell wall. So when the the antimicrobials enter them, or when you take the medication, they push the medications out of their system. So it causes the medication to be ineffective against them. As well as, you see, when medication is going to work, it has a site that it's supposed to bind to take effect. That is called the receptor site. So if this the fungi, the bacterials or the viruses, they tend to what? Change the receptor site. So if it's supposed to be triangular, it will change to be square. So that triangular medication size cannot fit in. The medication is left to be what? Ineffective. So how does it spread? So these are some of the mechanisms that the bacterial, the viruses, they develop resistance towards the antimicrobials. Now, how does it spread? First, you get a bacteria into you. You have the disease, or you have an infection. Now, that infection, so let's take the red crosses. The red crosses are the medications, the bacteria that are being killed. So we have the first picture, we have the light blue and the deep blue. The light blue is the weak microorganisms, and the deep one is the strong ones. Now, we take in a medication that is antibiotic or antivirus or antifungi, and the red crosses means that the medication has killed them. So you realize that in the nest, they are out. Now, what happens? There will be some of the weak or the strong ones left. I am very strong, so the medication didn't work against me. So I remain in your system. What happens? I am going to what? Reproduce. And reproduction is part of living organisms' life process. So when they're in your body and the environment is suitable for them, they're able to reproduce. So that is how they grow. That is how they grow. And when you sneeze, let's say you had a flu and you sneeze, that microbacterial, that is microorganism that is in you, that is very strong and had developed resistance. It spreads to my next sister here. Her condition now is no longer a normal flu. It is the flu that she has gotten that is made up of microorganisms that are resistant to medication. So please, the AMR and Ghana healthcare system. So a healthcare system consists of the people, the organization, institutions, which come together to ensure that we have good health. And then its examples have the Ministry of Health, the Ghana Health Service, hospitals, chief compounds, and the rest. So we have the World Health Organization. So before a healthcare system can work, it needs. Okay. Okay, so let's go straight to the statistics. Let's move to the statistics, how AMR has become a burden. So globally, the stats, global, yes please, so AMR, according to the World Health Organization, AMR is a global emergency and it has been ranked top 10 health problems in Ghana. So among all the health problems we have, AMR has been ranked top 10, which should tell you that it is.
Thank you, Rainy. Sorry, I'm having a cold. Thank you, Rainy, for taking us through antimicrobial resistance. So I'll be taking you through the causes, effects, prevention, and control, and also conclude our presentation. So going through the causes of antimicrobial resistance, we have the three main factors, and the causes can be best understood when we use the One Health approach, which will get to know that human health, animal health, and environment are interconnected. So moving straight to a human factor, we being self-medicated, not going to the hospital or seeking a prescribed medical attention from the professionals, and we medicating ourselves can cause antimicrobial resistance. Also, misuse of antimicrobials, which is we normally use antibiotics for antivirals. That's the second point. We move to the third point. Stopping the medication in the halfway. Sometimes when we go to the hospital and we prescribe medicine for us, after taking 2 or 3 pills and we start feeling okay, we stop at the halfway because we think we are okay. This gives the organism the strength to resist another medication when you are not feeling well. We move to the animal factor. So when we feed the animal with the antibiotic for disease prevention and also for growth, it later on transmits to us through their food and direct contact. We move to the environmental factors. Poor sanitation, improper disposal of medicine can also contribute to causes of antimicrobial infection by giving us we move to the impact or the effects of antimicrobial resistance. So antimicrobial resistance does not affect only one agent or only one factor. It affects the patient, the healthcare system, and the society at large. So when you take the patient, treatment failure is one of the impacts of antimicrobial resistance because we have been self-medicating ourselves. So the organisms have grown resistant to the medication. So treatment failure will set in there. And we go to longer illness. Disease that were supposed to be cured within 2 to 3 days will be taking weeks and months before they cure. We move to the impact on the healthcare, which longer staying in the hospital. Because you are not recovering from the medicine that she has been given to you, you intend to stay in the hospital for a longer period of time. High cost of the medical expenses. Society impact, also move to reduce productivity. The farmer, that will be farming or cultivating.
Hand of applause for our presenters. There were a whole lot of talking. Judges, over to you. Please, what do you make of their presentation?
Okay, so the choice of topic is a very good one, and I applaud you for that. Yes, it's a very good topic, and I feel like you've done justice to the topic, although the time didn't permit for you to finish. Especially the first presenter, the flow was there. I liked it. Everything was on point. But one advice I would want to give is, you see, this is a collaboration. Okay, we are all supposed to stay within time. So, in as much as you want to explain for us to understand all the things you want to bring out, you should also consider the other person that you are presenting with. I hope you get it. So, you keep in mind that time management is also important. Generally, I think you did well in terms of how you guys worked in the confidence with which you started everything. I liked it. Keep it up. Thank you very much.
Dinah.
One question I had for the second presenter, when you were talking, you spoke about antibiotics being introduced into our bodies through animals, as in antibiotics we give to animals, then we end up eating it. Then, so is that you saying that we are not supposed to um, immunize or vaccinate animals, as in the veterinary medicine aspect, or if it is supposed to be done, what do you suggest should be done so that we don't end up having resistance to antimicrobials?
Okay, so thank you for the question. So most of the farm animal farming, the farmers, no, they don't use the appropriate way to treat for the disease of their livestock. So it's either we educate them on using the best medication antibiotics for their livestock in appropriate manner, dosage, everything they have to learn. We have to educate them on it.
Okay, so your concern was about self-medication in animals, not as in like a recommendation by veterinary to give those medication. Is that
Yeah,
the case?
they they don't go to the veterinary for the appropriate antibiotic. They intend to
Give
give them
medications
to the,
themselves.
yes.
Okay, that's fine. Thank you.
Dinah.
I love your dress, and then I like how you were eloquent in your delivery. However, when you are asked to make a PowerPoint presentation and then you've been allocated time, were you told that you have 10 or 15 minutes for the presentation? So did you rehearse? Did you go over the presentation?
Yes, please, we went over it.
Did you time yourself? No,
As
you didn't. You thought we'll be lenient with the time management, right? That's why. Anyway, when you are doing it, what's your topic?
antimicrobial resistance and its effects on Ghana's healthcare system.
So when you are given a topic to make a presentation on, your focus has to be on what you want your audience to know, because there is time allocated to it. So the introduction and all the plenty talk, you have to like limit it. That is not your concern. Telling us about, or when we told you time was up, you're still trying to all those things are not what you want your audience to take away. So you have to leave all those, edit your slide over and over again, and make sure that at the end of the day, what you want your audience to take home is still there. However, it's not packed because your slide is packed. Too many information for me to accumulate. So please, next time when you are asked to make a presentation, you have to rehearse, go over, make sure that you are more focused on what you want your audience to take home, not the other ones. You have to just say something brief about it and then you go on. Aside that, you have done well.
Aside that, you have done well. Rachel,
Yes, please. I like the topic, but please, what informed the choice of topic? What informed the choice of topic?
The choice of topic was okay. Actually, when we looked at the topic, we wanted to tackle something that is really, really a problem to our healthcare system. And as nursing students, we realize that I sometimes ask myself question that what again can be the cause of so many deaths in the country apart from just the diseases, and I feel antimicrobial resistance is a part of the deaths that we have.
So please, did you feel that you tackled that? Did you talk about that? Did you deliver that to us?
To my expectation, not much, but we have tackled it.
Okay. Please, can you briefly talk on the effects of AMR on the Ghana health system? Because it's part of your topic, but we didn't hear anything about that. So just briefly.
Okay, so Ghana healthcare system, according to the WHO, it has 6 building blocks. That is service delivery. So AMR, when it happens like that, it affects our service delivery in that one, it affects the patient's long stay in the hospital. So you would stay longer in the hospital, which we realize that these days there's no bed syndrome. So it means that when patients are supposed to be treated a week and go home, they get piled up in the hospital because of longer durations in the hospital. So it makes our healthcare delivery not enough. Yes, please. That's one way that it has affected our health.
This is also increase the expense, the cost of the healthcare given to them. Since you were supposed to stay there for maybe 3 days, now you are staying there for 3 weeks and months. So it increased the cost of your healthcare being provided to you.
Please, I want more because that's the you wanted to talk about that
Yes.
and you didn't. So now I'm giving you the floor to do.
Okay. So another way it can also affect is finances because it's also part of the 6 building blocks of World Health Organization.
She has talked about the finances already. Another one,
Yes.
please.
Okay. Another one can be finances in a way that if the medication that we are bringing on, because we are changing it or evolving it, becomes more expensive for people to buy as well.
It's fine. It's okay. Thank you. And another one, please. The environmental and animal causes of the resistance. Please, can you talk about its mechanism? I didn't get that part.
So the animal process of this is where livestock animal farming. This is where they use antibiotics that is not prescribed from the veterinary. They use their own to treat to prevent disease and for growth in their livestock. So later on, those microorganisms that resisted the antibiotic, it will be transmitted to us through the food and direct contact. And also the environmental part is the improper disposal of waste and the improper management of medicine.
The mechanism, how does it occur? How will it go from the disposal to the human being, then the resistance? How would that happen?
Okay, when it comes to the animal as well.
No, not the animal, the environment.
The environment. Okay, so let's say in inappropriate disposal of our waste. One point I can use is, let's say, in situation where there's open defecation. So someone has been infected with the disease and then has been taking unprescribed antibiotics. So that person's there have been bacteria in the system that are resistant to the medication. So when the person's either does open defecation or doesn't take care of the environment and that microbes is left there, and then another person, let's say flies or other organisms, and it gets transferred to the person through food or any means, the person gets that antimicrobial resistant organism within them, and that's one way that a new person who has gotten the infection gets antimicrobial resistance also.
I want thank you. I'll ask the experts for the other mechanisms. Okay, thank you.
This is a correction I want to make. When we're doing the presentation, I was saying bacterias. So one is bacterium, multiple bacteria. So if you want to talk about it, bacteria is bacteria, not bacterias. Do we get it? Okay, thank you.
Thank you so much for.
Lastly, your mannerism. I forgot to talk about it. When you are making a presentation and then you make a mistake or you forget, you just have to pause and take the sentence over again. However, when you were missing some of your lines, you were bringing out your tongue and you were doing your face. Please, I beg. Next time, let's watch that. Okay, that's all. Thank
Thank you
you.
so much for your presentation. Please, you may have your seat. A hand of applause to them.
And Sarah. And we are presenting on chlamydia. So we're going to talk about how chlamydia is the most common sexually transmitted infection in the United States and the world. It's often called the silent infection because it usually does not show symptoms. Okay, so let's head into our myths and facts. So, myth is, oh, I can tell if someone has an STI.
Most people with chlamydia show no symptoms.
Mhm. And then, I got treated, so I'm immune.
You can get reinfected if you have sex with an infected partner.
Oral sex is safe.
You can get chlamydia in the fluid from oral sex.
Only promiscuous people get it.
Anyone who is sexually active can get chlamydia. One might ask, what is chlamydia? Chlamydia is a preventable and curable sexually transmitted infection caused by the bacterium Chlamydia trachomatis, which is primarily transmitted through vaginal or anal sex.
Mhm. So, as she mentioned, chlamydia can be transmitted through vaginal, oral, or anal sex. So, it can be transmitted through sexual contact, but it can also be transmitted through contacts from a mother to baby. And this typically happens during childbirth. The mother will transmit chlamydia to the baby due, through childbirth, and this can cause eye infections as well as pneumonia in the baby. But chlamydia is not transmitted through casual contact such as hugging, kissing, sharing toilet seats, or swimming pools.
Symptoms of chlamydia can be shown in both women and men. So for women, approximately 70% show no symptoms at all. Sorry. And they may experience abnormal vaginal discharge, burning sensation during urination, pain during sex, bleeding between periods and after sex, and also low abdominal pain. And for men, approximately 50% often show no symptoms. They may also experience clear or cloudy discharge from the penis, burning or itching sensation during urination, and pain and swelling in the testicles as well. Here are some symptoms of chlamydia. And also, you should note that chlamydia doesn't look like sores, blisters, warts, or rashes.
Okay. So, if chlamydia is left untreated, it can cause potential complications. So, for women, it can cause pelvic inflammatory disease, which is also known as PID. This is a serious infection of the uterus and fallopian tubes. And so, PID can also cause infertility, making it another potential complication of chlamydia. And how that happens is the scarring in the fallopian tubes can block it, so then it would make getting pregnant very difficult or impossible. And then it can also cause ectopic pregnancies, which is when the pregnancy happens outside of the uterus, which can be very life-threatening. For men, the potential complications is epididymitis, which is painful inflammation of the testicles, which can lead to infertility as well.
How is chlamydia diagnosed? So it's quite easy and painless. In the sense, a urine sample is collected, or in certain cases, a swab is used at the infected area. And annual screening is recommended for sexually active women under 25 because they are of higher risk of getting chlamydia. Also, women above 25 with risk factors like unique partners and multiple partners. Men who have sex with men and anyone with symptoms.
Okay. And so the good news about chlamydia is that it is completely curable. And so what happens is that you will be prescribed antibiotics like azithromycin or doxycycline. So there are different types. You can either take the medication, and then for 7 days after, you have to remain abstinent. You cannot have sex, or you take multiple pills over, I think, about a week. And during this time, you also should not have sex until you are done with the pills. If once you're taking medication, your partner has to be treated as well. If not, you can get reinfected. And then it is advisable to be retested every 3 months afterwards.
Let's shift our focus to prevention. As we all know, prevention is key. the most reliable way to um, prevent yourself from getting chlamydia is to abstain from sex and not have multiple partners. Also, if you are sexually active, you need to use a condom from start to finish. Also, regular testing is a way of preventing chlamydia.
Okay. So, so here's some statistics about chlamydia. In 2020, an estimated 128.5 million people were reported to have new infections of chlamydia worldwide. Most of them aged from 15 to 49 years old. And then about 1.5 new cases of chlamydia happen every year as well. More than half of all diagnosed cases in the U.S. occur in young adults from 15 to 24. And the global prevalence among people aged 15 to 49 years old was about 4% for women and 2.5 for men.
In summary, chlamydia is a bacterial infection that is widespread, often symptomless, but potentially serious if untreated. However, it is completely curable and preventable. I encourage you all to make your sexual health a priority. Thank you for your attention, and we are happy to answer any questions you may have.
Thank you so much. Please, a hand of applause for them. Rachel, do you have any question for them? Who's going first? Anna.
Okay, so first of all, I would want to ask, what is the concept? What's the concept you're trying to put out there? Is it because I'm seeing two different things? Either you are doing separate presentations, or you try to do it like not a TV show, but kind of see how they do the weather forecasting. This one will talk, another person will talk. So we want to get it. What is the concept? Let's begin from there. Then maybe a follow-up questions will come.
So our concept is just a presentation. The reason we're taking turns is to make sure that, well, everybody was going to get like four slides, but we just wanted to go back and forth to also follow up on like our myths versus facts. It was each of us saying, like, going back and forth. So we wanted to continue with that theme throughout the presentation.
Okay. So the next thing I would want to say is, this is a presentation. You are presenting to us, not to yourselves, right? Uh-huh. But at a point, we thought like this one is talking to this one is talking, another person is talking. I get in the whole point I'm trying to put across. It didn't come out like you are speaking to us. It felt like we are the one trying to eavesdrop on you. Do you get what I'm trying to communicate? So the same way you see the way as I'm talking to you, everybody else can hear me that I'm talking to you. It should have been more like that. Your eye contact. For please what's your name more, right?
Yes.
At a point it was just your phone and yourself. You look at the screen of your phone, you speak, you look, and we're trying to see eye to eye so that at least we can relate to what you are trying to put across. Please, I hope you get it. Uh-huh. And there was one thing that you mentioned. You said that I think what you're talking about the myth. Oral sex is safe, and she said no, you could get it through your throat, right? And I'm hearing another thing like you can't get chlamydia through kissing. So if somebody is being infected in the throat, how is it that another person can't get it if the person is kissing them? Let me understand the whole um, rationale behind it. Or if there is something I'm missing,
So
let's understand it.
so through kissing, like for example, like pecs, saliva isn't shared, but even through kissing with saliva, it's very rare to get chlamydia through saliva. Through oral sex, fluids like, yeah, genital fluid would be produced, and which is what carries chlamydia. So that was how you would get chlamydia through oral sex.
Yes, please. Very much. You both did so well, but I don't appreciate the newscasting presenting. We were hearing two voices at the same time. By the time I look on my sheet and I raise my head up, the voice is gone. Then but I'm about to scroll, I raise again, then the voice is gone again. So I didn't know who was saying what and who was saying this. Okay, it was mixed up in my head. But you guys did well. And my first question is, what's Ghana statistics saying about chlamydia? I didn't say that, but you brought a statistics. So what's happening in Ghana currently? That was in 2020. What you brought was in 2020. But do you have an idea what's happening in Ghana currently?
We didn't really research about Ghana specifically. We just researched about the world as a whole. Yes. Yes. Prevalence. How important something is currently. Prevalence is how important something is like currently in the moment. It means that like it's more like the prevalence of chlamydia is 4% in Ghana.
Mo, is that your
a take home point? Is that your take home point too? Okay, my final question. Please, for the diagnosis, when you got to that point, you just said a urine analysis will be done. What are we to expect at the diagnosis? When you got to that point, you said a urine analysis will be done. Please, can you elaborate more on the diagnosis of chlamydia?
The urine sample.
Please, elaborate on the diagnosis of chlamydia.
Okay. So, so for the diagnosis, a urine sample is taken, but in certain cases, in certain cases, a swab is used at the infected at the infected place. Yeah.
And then what?
Pardon?
After the swab is taken, after the urine is taken, what happens?
The test.
What test is being done?
I didn't.
More?
We didn't search for that.
Do you know the test? Okay, thank you.
So generally, the concept was a nice one. Okay, you see, the reason why I was asking question as to what exactly you were doing, what she said earlier, that if you had made it more fun, you see, when you started the myth and then how you are debunking it, this one will say, and after you respond with the actual truth, then there'll be a reaction. Oh, really? I didn't know about that. Then she mentions another thing that this made to, they say, no, that is not it. This is the actual meaning. You get the whole thing. So that it will draw whoever is listening. Please, I hope we get it.
Yes, please.
Uh-huh. And then with the topic, it was a broad topic that you selected. You just said chlamydia. But then if I don't know whether you had it there, an outline, that is what you're expecting us to know at the end of the presentation. Maybe we know the definition of chlamydia, how it comes about, diagnosis, treatment, prevention. Was there anything like that
Yes,
in your
please.
slide? Uh-huh. So when she was asking about the take home, you should have just capitalized on that one, that this and this is what you wanted us to know so that we understand it clearly. Probably we missed some parts, but when you mention it, we understand that that's the conclusion of your whole presentation.
Yes.
Are we good?
Yes,
Yes, please. Thank you very much.
Thank you.
All right, thank you. You may have your seat. Yeah, so at this point, we are waiting for the judges. Yes, so there's going to be an eviction. We have 8 beautiful ladies here. One or two queens will be kissing this competition goodbye. The judges are going to select 5 winners for us. I mean, top 5 contestants who did well in this presentation. And then the last or the bottom 3 will be determined by the votes as well as their performances. So we have in our midst Mark Brown, Miss Namsa, and she would like to have a conversation with us. A hand of applause for Mark Brown.
Good evening. Please, I hope you are all doing well. Okay, please, thank you very much for this opportunity. My name is India Magdalene Dima, the current NAMSA Queen. So this afternoon, I wrote something and then I wanted to share with you. Thank you. So as queens, people see the confidence, the elegance, and the smiles, but they don't see the pressure, the stress, or the silent battles we find we fight behind the scenes. Sometimes we are expected to look perfect, even when we are not okay. And that is why conversations like this are important. Health is not just about how we look on the outside, it is how we feel within, mentally, physically, and emotionally. Because the truth is, you cannot truly shine if you are not well. So as I continue, today I'm declaring to you that I'm aspiring for NAMSA president. It's actually the first time a lady is aspiring for such position. And we all know it's not going to be easy. So as queens, I'm soliciting for your votes and then your support as well. Help me so that we win this election together. And then I also want to encourage each and every one of you. Never underestimate the power you carry. Your crown is not just on your head. Maybe for now you don't have physical crowns, but you are queens. Yes. So let your voice and your actions encourage others. Thank you very much.
Thank you so much. I have a saying that I always say that if all you wear or if all you want is a crown, then go and get it. But if you want to live and inspire, you join a pageant and then you gain one. Thank you so much for that inspiring, communication or conversation with us. Judges, please, are you ready? Okay, so I'll come back to my quiz. How do you feel after this presentation? Do you think you are kissing this competition a goodbye, or you think you are staying? Rennie,
For me, I would say I'm not kissing this competition a goodbye.
she's not kissing the competition a goodbye. Interesting. Blue,
I'm staying.
she's staying. Sylvia,
I'm hoping for the best.
she's hoping for the best. Sarah,
I'm also hoping for the best.
hoping for the best for Neyad also. Mo,
Hoping for the best.
hoping.
I'm confident.
She's confident and still hoping for the best. Hello.
I want the crown.
She wants the crown. Oh my God, she wants the crown. Adeline.
I'm saying.
She is definitely staying. Interesting. So who goes home then? Who goes home? It's a question for the gods. So we are leaving all to the judges.
The moment of truth. Please, you can take over, judges. So at this juncture, we call all our queens to line up. Kindly give us a catwalk and then come in front. Now our queens are walking. I present to you our beautiful queens. The question is, who is going to be evicted? The question is, who is going to be evicted and who is staying? I present to you the contestants for Miss UHAS 2026. Who is going to be evicted and who is staying? The judges has the answer to that. And the question is, did you vote? Did you vote for these beautiful queens? One or two of these beautiful queens will be kissing the contest a goodbye. Who would that be? Please find out. Ooh. Right. So before the contest or before this crown and health presentation, I think the MC read the rules to all of you. The judges are going to choose top 5, the ones who did very well with this presentation,
And the bottom three will be decided, their fate are going to be decided by the votes and their performances today. So 50% vote, 50% performance. Although they presented in pairs, the score was individualized. The question is, who leaves the competition? Judges, over to you.
Okay. Ladies, you all did a fantastic job with your presentations, although we had little issues, which I believe that we've all learned. And then in our subsequent ones, we'll do better. We all agree on that, right? Okay. But then this is a competition, and then at the end of the day, there's someone that will come first. There's someone that will be at the bottom. We all can't be at the bottom. We all can't be at the top. So in all, whatever happens here, we take it like a step for a better future as we've learned new things. I hope we all get it, right? But then if you happen to be evicted today, it doesn't make you less of a queen. Do we get it? You can just walk with your chest out and because you did extremely well. Okay. So back to our sheets. We need Miss Blue to step forward. Rini, step forward. Elom, step forward. Congratulations, you're moving to the next stage.
Congratulations. Please, you may have your seats. Congratulations, Annie, Blue, and Elom. Please come forward a little bit, one step ahead.
Adolin, step back. One step back. Sylvia, same. Okay, the two of you can also go backstage as well.
Congratulations, Adeline and Sylvia. Wait, judges, wait. How do you feel?
A little nervous.
I thought you said you were staying.
That's what I thought, but you can't read the judge's mind.
You can't read the judge's mind, Farah.
I don't know.
I don't know. Me too, I don't know. Who is going home? Judges?
So are we staying or we are leaving? How is the feeling like?
Staying.
Oh, where is the confidence?
Ayura.
Okay, so do you want us to save? I need to save one person.
Yes, please save one and we will take it
I'm
from here.
saving one. But that with that, I'll leave it to Miss Rahel to do that for me. We are saving one. So who are we saving?
All right.
Is it Mo? Is it Farah?
Audience, is it Mo, Farah? Who should we save? Okay, then both of them are going home.
Okay, then bye. Who are we saving? Okay, so I'm leaving it to both of you. Who should we save?
Who should we save?
Just sacrifice one.
That's so sad.
Okay, judges, please do as the honors. Save one.
Okay, Miss Rahel.
Aye.
Let's be happy when you are. So you both, this is my 2 points. You both did well, but I think the seriousness was very minute compared to the other people. Okay, I'm saving the both of you, but this is my 1 cent. The seriousness. Are you taking this seriously? Are you learning, or you just want to come and do what you can do and leave?
Miss Rachel, please, could you save just one for us?
We are still saving the both of them.
You are saving both of them.
Yes, please. We want to save the both of them. We want to give them another chance. We want to see what they can do.
All right, congratulations, Queens. You might have your seat. So there are 8 contestants for Miss UHAS, and this presentation, I think it has the accumulation marks is 50, and then one contestant was absent. So even if we are adding the votes and the presentation, since she was absent, it's so sad, but we have to evict Miss Opata. Miss Opata is evicted. Thank you. Women's SRC Women's Commissioner, please. Queens, are you crying?
Hi.
You are. Are you sad? Or you want to be evicted then, Opata?
No.
Oh, okay. We can exchange.
No.
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 Yeah, I remember Opata is her friend. Sorry. Opata is her friend. It's so unfortunate. So sorry about that. So we have 7 contestants for Miss UHAS 2026. There's going to be a debate competition, and one contestant may be evicted. So it's either 6 contestants who go for the grand finale or 7. So sorry, Blue. Please, may I? Where is? Please wait for your refreshments. There's a refreshment.
Okay, so before the WUFOM comes to speak to you, I would want to speak to you not as a judge, okay? That is our observation. It's a collective observation. It feels like there's no seriousness at all. You see, you are being groomed to be queen, okay? And I observed a few things here. How can a queen sit in a kitchen, you are out? The next thing is you are opening bottled water like nobody's business. You see GMP queens go out and then 2 seconds they are out of their seat. Do we see something like that? This is a learning ground. I already said it. We get that part. In as much as that is Miss UHAS, that is where you are being trained for bigger platforms. Okay. So no matter how the whole thing is looking, even how you sit. I saw someone just sit like this. Oh, fine. Are we getting this? Uh-huh. Even if not for the context, at least daily vibes here. You know that when you come to sit in a gathering, you don't just get up at the way you want. And okay, it is quite unfortunate that we don't have a lot of people here. But I want to ask that if you had great audience and you just your sit and you just get up at any point in time, let's see some kind of urgency in it. Even when you were called to modern image on into your presentation. Now somebody's carrying the handbag, you get there, you now when you're coming from the gate, you want to see the model guys right from the gate. So as you enter, all the models are and things that's on there. There's one now that you come and drop your luggage and now before us, then you get it. I believe all these things are things that we've spoken about, or it wasn't said during your viewing sessions. Is there something we are missing? It wasn't said. It was said. But even if it wasn't said, you watch beauty pageants, right? Uh-huh. I don't think you expect that when Etonam will come and sit here and then 3 seconds, Etonam are setting up fake tissue as if now we sit here, we are waiting for one contestant that has gone somewhere we are searching. I get in the point. Let's see some seriousness in you, so that whoever is trying to support you will see that at least the contest is being taken personal. You people are actually taking it serious. I hope you get it. In terms of outfits for presentation, most of you did well. You did well with that. But my point, the part I was disappointed is the whole thing was just messy. You don't even know where you're supposed to start working from. I don't even know whether when you sit, you're supposed to sit like this or you do like this. That is not what queens are supposed to do. So moving forward, before the grand finale, we expect that all these aspects to be polished before that time. Do you get it? Is there any other thing that you want to ask questions on so that we address for you? This time, whatever conversation you are having here is not on the ground.
Our Heavenly Father, we thank you so much for this day. We thank you for all that you've done for us through the start, from the start of Miss UHAS till now. We thank you for your presence with us. We thank you that you've been with us, that the contestants have been able to do something better, and then they've been able to learn from their mistakes too. We pray, oh Lord, that the subsequent ones, your presence will be with us, and at the end, we'll give you the glory. In Jesus' mighty name, we pray. Thanks you for answered prayer. Amen. Happy birthday, package.